Hello everyone. In this video, group number 7 will be presenting Barbara Dossey and her theory of integral nursing. The group 7 are Lynn, Cabellon, Tenzin, Donsel, Meryl, George, Eunice, Owusu, and Marian Joyce Serrano. Here is the outline to be discussed in this presentation. Just have a seat and relax. Enjoy. Barbara Dossey is an internationally recognized integrative, holistic nursing pioneer, a nurse theorist, and a Florence Nightingale scholar. She has received many awards, authored or co-authored 24 books, and is a certified nurse coach. A major focus of her work includes integral and holistic nursing, global nursing, and integrative nurse coaching. She is co-director, International Nurse Coach Association, INCA, North Miami, Florida, International Co-Director and Board Member, Nightingale Initiative for Global Health, NIGH, Washington, D.C., and Calwood, Manitoba, Canada, and Director, Holistic Nursing Consultants, Santa Fe, New Mexico. Beginning in May 2015, Barbara has served on the American Nurses Association Health Nurse Health Nation TM Grand Challenge Advisory Board. Also, NBSP, Dossey is an 11-time recipient of the prestigious American Journal of Nursing Book of the Year Award. Barbara Dossey's theory of integral nursing. According to Dossey BM, 2008, theory of integral nursing can inform and shape nursing practice, education, research and policy local to global to achieve a healthy world. A theory of integral nursing, informed by integral theory, presents the philosophical foundation and application of an integral worldview and process. This theory also recognizes Florence Nightingale's philosophical foundation and legacy, healing and healing research, the meta-paradigm in a nursing theory, nurse, persons, health and environment. Society, 6 patterns of knowing, personal, empirics, aesthetics, ethics, not knowing, sociopolitical.
Of theory of integral. 1. Healing. 2. Meta-paradigm of a nursing theory. 3. Patterns of knowing. 4. The 4 quadrants. 5. ACAL, all quadrants, all levels. 1. Healing. The theory of integral nursing embraces the central core concept of healing, Dossey, 2007. It embraces the individual as an energy field connected with the energy fields of all humanity and the world. Healing is transformed when we consider 4 perspectives of reality at any moment. 1. The individual interior, personal/intentional. 2. Individual exterior, physiology/behavioral. 3. Collective interior, shared/cultural. 4. Collective exterior, systems/structures. Notes: each aspect of healing has equal importance and value and leads to more complex levels of understanding and meaning. The second content component in the theory of integral nursing recognizes the meta-paradigm in a nurse theory, which are the nurse, person, health, and environment, society, Dossey, 2007. These concepts are essential to the theory of integral nursing because they are encompassed within the quadrants of human experience. Notes: healing at the center. A Venn diagram surrounds healing that implies the interdependent impact of these domains as each influences the others. A change in one creates a degree of change in the others, thus affecting healing at many levels. The nurse is an instrument in the healing process. Nurses assist and facilitate individuals with accessing their healing process and potentials. A person is defined as an individual, patient/client, family member, significant other, who engages with a nurse in a manner that is respectful of a person's subjective experiences of health, health beliefs, values, sexual orientation, and personal preferences. A person also can be an individual nurse who interacts with a nursing colleague, other healthcare team members, or a group of community members or other groups. Integral health is the process through which nurses reshape basic assumptions and worldviews about well-being and see death as a natural process of living. An integral environment has both interior and exterior aspects. The interior environment includes the individual's feelings, meanings, mental, emotional, and spiritual dimensions. The exterior environment includes objects that can be seen and measured related to the physical and social in any gross, subtle, and causal levels. These 6 knowing patterns are personal, empirics, aesthetics, ethics, not knowing, and socio-political. Dossey, 2007. Notes: these patterns of knowing assist nurses in bringing themselves into the full expression of being present at the moment with self and others, to integrate aesthetics with science, and to develop the flow of ethical experience with thinking and acting. The 4th component examines 4 perspectives for all known aspects of reality, or expressed another way, it is how we look at and describe anything. Notes: starting with healing at the center to represent our integral nursing philosophy, human capacities, and global mission. Dotted horizontal and vertical lines illustrate that each quadrant can be understood as permeable and porous, with each quadrant experience integrally informing and empowering all other quadrant experiences. Within each quadrant, we see I, we, it, and it's to represent 4 perspectives of realities that are already part of our everyday language and awareness. These 4 quadrants show the 4 primary dimensions or perspectives of how we experience the world. Dossey, 2007. The 5th content component in the theory of integral nursing is the exploration of Wilber's all quadrants, all levels, all lines, all states, all types or all. Dossey, 2007. These levels, lines, states, and types are essential elements of any comprehensive reality map. The theory of integral nursing addresses how we can increase our critical awareness, wholeness, and healing, and strengthen our personal and professional capacities to be more fully open to the mysteries of life's journey and the wondrous stages of self-discovery for ourselves and others. Dossey, 2007.
Philosophical assumptions. In a theory of integral nursing, the philosophical assumptions are as follows. 1. An integral understanding recognizes the individual as an energy field connected to the energy fields of others and the wholeness of humanity. The world is open, dynamic, interdependent, fluid, and continuously interacting with changing variables that can lead to greater complexity and order. Second is an integral worldview is a comprehensive way to organize multiple phenomena of human experience from 4 perspectives of reality. 1. Individual interior, subjective, personal. 2. Individual exterior, objective, behavioral. 3. Collective interior, intersubjective, cultural, and 4. Collective exterior, interobjective, systems or structures. 3. Healing is a process inherent in all living things. It may occur with curing of symptoms, but it is not synonymous with curing. 4. Integral health is experienced by a person as wholeness with the development toward personal growth and expanding states of consciousness to deeper levels of personal and collective understanding of one's physical, mental, emotional, social, and spiritual dimensions. 5. Integral nursing is founded on an integral worldview using integral language and knowledge that integrates integral life practices and skills each day. 6. Integral nursing is broadly defined to include knowledge development and all ways of knowing. 7. An integral nurse is an instrument in the healing process and facilitates healing through her or his knowing, doing, and being. 8. Integral nursing is applicable in practice, education, research, and healthcare policy. Barbara Dossey, Ph.D., RN, has played an instrumental role in expanding the domain of traditional nursing. As a pioneer in the holistic nursing and nurse coaching movements, she has worked to advance the practice and philosophies of holistic care, both within the health professions and in the lives of lay people. Barbara articulates how healing is promoted by attending to the delicate interaction of body, mind, and spirit, and how centuries-old concepts can be successfully applied in the care of patients and in everyday living. Link Florence Nightingale's legacy of healing, leadership, global action, and her work as a nurse and citizen activist to 21st century holistic, integral, and integrative nursing. Determine whether you have an integral worldview and approach in your clinical practice and other education, research, hospital policies, and community endeavors. A 21st century Nightingale who is engaged as a health diplomat and an integral health coach who is coaching for integral health. Apply relationship-centered care principles and components in your practice. Compare and contrast the 3 eras of medicine. Examine the theory of integral nursing, and begin the process of integrating the theory into your clinical practice. Create an integral self-care plan. Examine ways to enhance integral understanding in your personal endeavors. Develop short and long-term goals related to increasing your commitment to an integral developmental process. All nursing practice that has healing the whole person as its goal and honors relationship-centered care and the interconnectedness of self, others, nature, and spirituality, focuses on protecting, promoting, and optimizing health and wellness, incorporates integrative modalities/complementary and alternative modalities, CAM, as appropriate. A theory of integral nursing, informed by integral theory, presents the philosophical foundation and application of an integral worldview and process. This theory also recognizes Florence Nightingale's philosophical foundation and legacy, healing and healing research, the meta-paradigm in a nursing theory, nurse, persons, health and environment, society, 6 patterns of knowing, personal, empirics, aesthetics, ethics, not knowing, socio-political, and other non-nursing theories.
Here is a sample case scenario. Mr. A, a 55-year-old patient, suddenly experienced sudden shortness of breath, lightheadedness, cold sweating, and palpitation while mowing the grass at noon. He is also suffering from chest pain that radiates to his left arm and shoulder. Mr. A's wife immediately sent Mr. A to the emergency room. In the emergency room, Mr. A still felt pain in the chest but is minimal. His medical doctor decided to admit Mr. A for further diagnostic workup and evaluation of his current condition. He was diagnosed with unstable angina. History. Work: hard-working general laborer in a furniture factory for 10 years. Family history. His father died from cardiac arrest 2 years ago. His mother is in retirement who is diabetic and hypertensive. Medical history. Hypertensive for 5 years. Diabetic for 8 years. Chain smoker, 1 pack of cigarette per day. Obese. High in cholesterol. Mr. A and his wife are married for 30 years and have 3 children, 2 boys and 1 girl. Both Mr. A and his wife are currently working. Mr. A is a very busy man. If he is not working, he helps with the chores at home. Mr. A has a close relationship with his children. When Mr. A got admitted, his children were very concerned about his health condition. They supported their father by visiting him regularly.
Chest pain can be assessed using different ways. In order to assess Mr. A, we will be using PQRST pain assessment tool so that the pain can be assessed accurately, and this tool is the one that is widely used. Position/location. Position/location factor for Mr. A was assessed using the following questions. Could you point me to the location where you are feeling the pain? Mr. A pointed to the chest. What were you doing when the pain began?
I was mowing the lawn grass in our backyard.
Is there anything that makes your pain better or worse?
Nothing as far as I know.
Quality. Mr. A, could you please describe the pain? Is it dull, sharp, squeezing, pressure, burning, aching, pounding, cramping, stabbing or crushing?
It is like squeezing.
Radiation. Is there any other location where you experience the pain?
It is radiating to the left arm and shoulder.
Severity/symptoms. Could you please rate the pain on a scale of 0 to 10? 0 being no pain and 10 being excruciating pain.
Between 3 and 5.
Did you notice any other symptoms with the pain?
I can't breathe properly, feeling tired, sweating.
Time. How long have you had the pain for?
It started around 30 minutes ago.
Is the pain intermittent or is it continuous?
It is continuous.
Have you had the pain previously?
This is the first time.
Mr. A is working as a general laborer, and he was very much worried about his family when he was brought to the hospital. Since he is the breadwinner for the family, He was also worried about his family's future.
Nursing intervention. Assess the vital signs, mental status and symptoms of pain such as facial grimacing, rubbing of neck or jaw, reluctance to move, increased BP, and tachycardia. Note the onset, duration, location and pattern of pain. Assess the patient's perception of the pain's severity by using pain rating scale. Send blood sample for troponin, CKMB, comprehensive metabolic panel, CBC and obtain 12-lead ECG. Place the patient in Fowler's position and administer O2. Administer sublingual nitroglycerin as per ordered. Provide psychological support to the patient. Always encourage patient and give positive atmosphere. Advise the patient to do relaxation therapy like listening to music, doing light activities. Advice to stop work or hard work if experiencing any chest pain. Advice to take nitroglycerin in their pocket in case of emergency, and if pain do not subside after taking 3 doses of NTG, then call 911 immediately. Rationale: to rule out whether it is angina pectoris chest pain. To know the level or degree or severity of the pain. Troponin, a rise and or fall in a series of troponin results indicates a heart attack. CKMB, one particular form of the enzyme creatine kinase that is found mostly in heart muscle and rises when there is damage to the heart muscle cells. Comprehensive metabolic panel, a group of usually 14 tests that is used as a broad screening tool to assess the current status of an individual's kidneys, liver, electrolyte and acid/base balance, blood glucose, and blood proteins. CBC, a test used to screen for a variety of disorders that can affect blood cells, such anemia and infection. An ECG or EKG, a test that looks at the heart's electrical activity and rhythm. Continuous ECG monitoring, a person wears a monitor that evaluates heart rhythm over a period of time. To reduce anxiety and fear. Fowler's position: ease in breathing and oxygen if SpO2 is low. NTG helps in reducing chest pain or angina pain.
Although hard to read, heart attacks happen to both men and women. They are more common in women. One reason for this is that men's symptoms initially set the standard for recognizing heart trouble. Chest pain, a common early warning sign of heart trouble for men, was further down the list for these women. Those who did have it tended to describe it as pressure, aching, or tightness in the chest, not pain. Angina may occur in patients with arterial hypertension in the absence of epicardial coronary artery disease due to an abnormally elevated resistance of the coronary microvasculature. Because heart disease is often the cause of angina, you can reduce or prevent angina by working on reducing your heart disease risk factors. Making lifestyle changes is the most important step you can take. The main goals of treatment in angina pectoris are to relieve the symptoms, slow the progression of disease, and reduce the possibility of future events, especially MI and premature death. If you're overweight, talk to your doctor about weight loss options. Eat a healthy diet with limited amounts of saturated fat, lots of whole grains, and many fruits and vegetables. Talk to your doctor about starting a safe exercise plan. Because angina is often brought on by exertion, it's helpful to pace yourself and take rest breaks. Treat diseases or conditions that can increase your risk of angina, such as diabetes, high blood pressure and high blood cholesterol. Avoid large meals that make you feel overly full. Avoiding stress is easier said than done, but try to find ways to relax. Talk with your doctor about stress reduction techniques. Limit alcohol consumption to 2 drinks or fewer a day for men, and 1 drink a day or less for women. Immediate and appropriate treatment when angina occurs. Awareness of the disease process and understanding PF the prescribed care. Adherence to the self-care program. Absence of complications. Reported pain is relieved promptly. Reported decrease in anxiety. Understood ways to avoid complications and is free of complications. Adhere to self-care program. Smoking is one of the biggest risk factors of angina and CAD. The nicotine in cigarettes facilitates the constriction of blood vessels, which then increases the cardiac workload. This eventually damages the lining of the coronary arteries, as well as other blood vessels. Having a low cholesterol, low sugar diet to control cholesterol and blood glucose levels. Foods rich in omega-3 fatty acids such as fish, soybeans, and flax seeds are recommended. Taking prescribed blood pressure medications helps control hypertension. Increasing physical activity by doing at least 150 minutes of moderate aerobic exercises will help promote an active.
Client evaluation. Mr. A is expected to report relief of pain, report decrease in anxiety, demonstrate an understanding of different ways how to avoid complications and is free of complications, demonstrate an understanding of how vital is lifestyle changes for recovery, adhere to self-care program. Note, read, having a positive environment, full family support, and high-quality care from competent healthcare team members, Mr. A will eventually recover fully and go back to his optimal functioning level. The theory of integral nursing developed by Dr. Barbara Dossey helps to organize phenomena of concern to nurses in a comprehensive and contemporary way. This theory complements the principles of holistic nursing, human caring and healing. This theory presents a comprehensive model that helps to address the health and well-being of nurses, the healthcare team, clients, families and the healthcare system. It is based on an integral philosophy and incorporates concepts from the philosophies and fields of chaos, spiral dynamics, spirituality, complexity, systems, holistic nursing theories, and others. This theory also recognizes Florence Nightingale's philosophical foundation and legacy, healing and healing research, the meta-paradigm in a nursing theory, 6 patterns of knowing, personal, empirics, aesthetics, ethics, not knowing, sociopolitical, and other non-nursing theories. Integral is defined as a comprehensive way to organize multiple phenomena of human experience and reality in 4 areas from which the 4 integral principles of nursing emerged.